It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, welcome everyone. So let me ask you a question. How are your eyes? And how many of you have gone to an eye doctor to make sure that your eyes are doing well? Well, this is like part 2 of a show I've been doing with Hazleton Eye Specialists, Pottsville Eye Specialists, Bangor Eye Specialists, Nanticoke Eye Specialists, and Stroudsburg Eye Specialists. My guest, no stranger to our station and Channel 13 and Comcast, Dr. Thomas Kislan, who is the medical director. Now, I ask you about how your eyes are. If you haven't had an eye exam, we're going to tell you why it's so important. Anyway, Thomas, how are you?
Fabulous. Thanks for having me.
There's so many great things that are happening that, I don't know if we're going to be able to cover everything in this half hour. But let's talk about, first of all, why is it important that you should go for at least a yearly eye exam?
The eyes are the window of the soul, right? So, sometimes I joke with patients that the eyes are the only place in the body where we can see living blood vessels without cutting you open. So, we can see a lot of things. We can sometimes detect diabetes, high blood pressure, high cholesterol, MS. I mean, the list of systemic problems that we can help detect is long, but also it's just about maintaining your eyesight. As we get a little bit older, certain diseases can crop up that can slowly take your sight. So, macular degeneration, which we're going to talk about, is a biggie. Glaucoma, there's a long list, but those are probably the 2 biggies that can creep up on us and slowly take our vision.
Yeah, I decided to come to you for an eye exam. And I thought it was routine, and then you detected something, a little forming of a glaucoma, correct?
Right. Yep.
Now, I'm thinking in my mind, Tom, if I wouldn't have gone to you, okay, and just, all right, I could see, and that would have progressed, correct?
Yeah, glaucoma is a slow progressing disease, but yeah, it gets worse.
Yeah. So with me going there, I was able to detect that. So anyone who is, especially a senior, okay, it's important. But before we talk about, macular degeneration, which is great news that we have for people, and how you detect that, when I was at your eye care, Hazleton Eye Specialist today, I noticed the latest in equipment that you have. How important is that for the person, for that patient who comes in, to have that kind of technology?
I mean, technology has allowed us to more easily and comfortably for the patient detect diseases 5 to 10 years before we were ever able to do it before. So things like glaucoma, macular degeneration, diabetes, we can now detect before the patient is having vision problems, or actually sometimes before we look in the eye and see it. So we can tell by certain neurological tests we do what's going on. So the latest technology just it makes it better for the patient and better for us.
Well, there's no question that you have that technology. In fact, when I'm bringing a guest on via phone, Scott Gilliland, who is one of your patients. Now, let's talk about the main subject here, my friends, macular degeneration. First of all, what is it?
So macular degeneration is a disease that affects us as we get a little bit older, usually starts in maybe our mid to late 50s, early 60s. And it's kind of what it says. It's a slow degeneration of the retina or the back of the eye. So the retina, if you think of an old-time camera, the retina is the film that develops the picture and allows us to see. So the retina sends the message to the brain, and then the brain processes the information, and that's how we see. So if the retina slowly degenerates, we can't see. So there's 2 types of macular degeneration. There's what's called a dry form, which is the most common, and then there's the wet form, which means there's bleeding in the eye, and that's where we have shots or injections that we do for that patients have to go every 8 months to prevent them from losing all their vision. But the dry form is the most common. 80% of patients have the dry form, and it's also the one that up until now there was really not much to do for.
Okay, so what would be the symptoms, all right, for macular degeneration?
In the very early stage, sometimes nothing. Sometimes patients will just notice things aren't as clear as they used to be. They maybe think they need their glasses changed, or maybe they think they're starting to develop cataracts. As it gets a little bit worse, it could be waviness of vision, or sometimes patients wake up one day and all of a sudden they just can't see. They just, I'll have patients rub one eye and they're like, geez, I can't see out of the other eye. What happened? But they didn't notice it because both eyes work together. But in most cases, it's a slow blurring or distortion of the vision.
And no matter what age, you should be getting eye examined. I know when Dr. Diem had one show on even young children.
Infants.
Yep. Infants, have them come in and, you would think, well, what about that? It's so important.
And not to interrupt, but in our area, in Northeast Pennsylvania, we have one of the highest incidences of macular degeneration just because of our demographics. So it's usually Caucasians, older Caucasians, fair-complected, light-skinned, light-haired, light-eyed patients are the ones who get macular degeneration at a higher rate than, let's say, patients who are African American or Asian or things like that. So, our area, your viewership is a high concentration of macular degeneration patients.
And remember, if you're watching this and you know of somebody who may have a problem and they don't have cable, we have a YouTube channel. Go to our website, ssptv.com, and the show is there. You can get all the information. And the phone number is on the screen, my friends. That's the phone number I would advise you to call, even as you're watching us in Scranton, in Stroudsburg, in Pottsville, and Allentown. Just call that number that's on the screen. So you'll be able to find out or detect. Okay, and now all the doctors, they don't necessarily have to get Dr. Kislan. Let's talk about the quality of doctors you have in these different locations, because I want Dr. Kislan or I want Dr. Diem, okay? Let's talk about your staff.
I mean, all of our docs are great. In fact, we were just joking earlier that all of our doctors were actually my students except one. He's a couple years older than me, Dr. Olzinski, who's in our Stroudsburg office. But they're all my students, and so I know them very well. And I wouldn't invite them to join our team if they weren't, the great people and great physicians. So, I'm very proud to have the group of doctors that we have.
Before we talk about this great machine we have, okay, the Valeda, okay, what did you do for those people who had macular degeneration, the dry versus, and also for the wet? What would a patient go through?
So for dry macular degeneration, up until this point, it would be, vitamins, certain nutraceuticals, omega-3, certain antioxidants. We'd say protect your eyes from the sun, wear sunglasses, don't smoke. Smoking increases your risk of macular degeneration progressing by almost tenfold. Healthy diet, watch your cholesterol. That's all we had. So, patients would come in every year, and I've been in practice almost 30 years now, and unfortunately I've seen a lot of patients lose their vision from macular degeneration, and they'd come in and we'd be like, yeah, high five, your vision's gotten worse, but you're not wet. It didn't turn to the wet macular degeneration, so you don't need the injections. But there was nothing that I could do, nothing that we could do to really help slow it down or prevent it. So it was frustrating, and now we do. So still it's important to eat right, watch your diet, monitor your cholesterol, take your nutraceuticals, don't smoke, protect your eyes from the sun. But now we have something that can help not only slow the progression, helps to heal certain tissues, and in some cases, and in the studies, shown to help improve your vision, actually get your visual acuity back. We've never ever been able to do that before. And even the wet form, the injections, what they're approved for is to prevent progression. They don't bring your vision back. So this is the only macular degeneration treatment that actually has shown to improve visual acuity.
How'd you learn about this?
Well, I mean, what any good doctor does in whatever field they're in, they're always reading the journals and keeping up on studies. And, when we read about this stuff, this has been happening in Europe since 2019. This technology has been in Europe since 2019. They've treated 500,000 patients in Europe so far. So, we knew it was coming, but we just didn't know when.
You have the machines in what locations?
We can treat patients in Hazleton, Pottsville, and Tannersville. Bangor's not far from Tannersville, so those patients come down to Tannersville, and Nanticoke's 20 minutes from Hazleton, so those patients come up the road.
Okay. Now, my friends, we can take a break, and we're going to come back and talk to Scott Gilliland. He is a patient who has started this treatment, and we'll hear his story right after this. Welcome back to the Sam Lesante Show, folks, and once again, thank you for making the Sam Lesante Show the #1 talk show in northeastern Pennsylvania. I really appreciate it. 40 years I've been doing this and having fun every time I do a show. Remember, 24/7, if you have friends that do not have cable, you can watch us on our website, which is ssptv.com. Now, my friends, the show is about your eyes, and most especially if macular degeneration. My guest today is Dr. Thomas Kislan, who is the medical director of Hazleton Eye Specialists, Pottsville Eye Specialists, Bangor Eye Specialists, and Stroudsburg Eye Specialist, and Nanticoke Eye Specialist. Now, on the phone, we have one of his patients, Scott Gilliland. Well, first of all, thanks for coming on the show. I know you're excited to talk about this procedure. Now, the new procedure that they have, as if you just tuned in, is the Valeda, right?
Yeah.
And what does this machine do, doctor?
So Valeda is red light therapy, and just to give a little background, so red light therapy has been used in Europe since 2019 to treat macular degeneration. So using certain wavelengths of red light, it's been shown to heal tissue. So what they found in Europe after treating 500,000 patients is this treatment can help slow the progression of macular degeneration, heal tissue that's been damaged, and help restore vision. So in November of 24, it was FDA authorized in the United States, and it became available in around February-ish in the U.S., and we were proud to be to purchase the unit and have the technology for our patients in Northeast Pennsylvania around April or May of this year, and we were the first and only facility in Pennsylvania to have it. And right now there's one other one, but you know, we're proud to you know, kind of be a leader in this, and we found tremendous improvement with patients so far. It's early on, but it's working great. And as you said, Scott's here. He's actually Dr. Bellinger's patient in our Tannersville office, and you know, he's been pretty happy. So I'll let him tell his story.
Scott, let's talk about your story. Tell me about, you know, your eyes, what happened, and how this whole thing evolved. I'm sure our viewers are interested to know that.
Okay. I was diagnosed with macular degeneration probably in my early 50s. And I thought it was kind of interesting when Dr. Kislan talked about you know, the various things that you could do. It was kind of disconcerting because basically the only option I had were the vitamins, and obviously to try to lead a healthier lifestyle. When I really started to notice it was I was a sporting clay shooter, and it's kind of funny because I'd be out with my father-in-law, who's an excellent shot, and he would say, shoot, and I said, I can't see it. And that's when in my left eye, when it affected my central vision, and that's when I, you know, really started to have some trouble.
So how did you come about going to Stroudsburg? It was a Stroudsburg Eye Specialist, right?
Yep.
Yes.
How did that come about?
Well, I had the same eye doctor for over 40 years. I was one of his first patients. And unfortunately, as time goes on, he retired. And I was looking for an eye doctor, and I had known Dr. Bellinger because she was in our Lions Club in Tannersville. And I also knew her as a student of Pocono Mountain School District, where I was a principal. And I just talked to her one night. She said, well, come on in, I'll, you know, check you out. And that's how my association with her began.
So you went and she gave you an exam, and what happened then?
Well, I was going to see a retina specialist, and to be quite honest with you, they didn't offer me much help either, other than some new shot. And basically I was told because of my age that it may not really be great. And as luck would have it, I'd always been a patient of Will's eye from early on as a youngster. So I did go to them. They actually repaired a macular hole in my left eye. But at the same time, I would go see Dr. Bellinger, and one day I get a text message from her with a little snippet about Valeda, and she said, I want you to take this information, give it to your retina specialist, and see if he would allow you to get this treatment. And as luck would have it, it was like I had an appointment with the retina specialist in a couple days. So when I showed him the information, he was like dumbfounded. He goes, "Where did you get this from?" I said, "From my eye doctor." And he goes, and he's kind of befuddled, and he goes, "Well, do they have a machine?" And I said, "Well, I'm told that they don't have it, but they're going to have it in 2 weeks." And he goes, "Oh my goodness," he said, "we're Will's Eye Hospital." And he's going on, and he said, "All the locations we have, and we're only getting one. And it's in like Bala Kinwood." He said, "Where is she located?" I said, "Oh, about 5 miles up the road." He goes, "I want you to leave here, dial her up, and get on the list," because he said, as good as this is, we think it is, he said, they're probably going to be running this machine 24/7. So that's what I did, and I was blessed that Dr. Bellinger reached out to me. I really feel blessed that she did. She really went the extra mile.
Okay, so now, Scott, you're having treatments now, correct?
That is correct.
All right.
Yes.
So tell me how these treatments are working for you.
I think I'm overall very, very, very pleased. And I do want to say one more thing before I answer your question completely. When I went in to see Dr. Bellinger, they put me through like a whole battery of tests. And when Dr. Kislan talked about technology, I can tell you they have the latest technology. I've never seen anything like it of any place I've ever been. So they put me through the battery of tests, and they set me up with a schedule. And I have to say, I look forward to going. The staff there, Lisa, she's a wonderful young lady, and she's really excited about the procedure and very, very helpful. So they set up a schedule, and I started. When I leave there, it's kind of amazing. My eyes almost feel stimulated, so to speak. But they have tested me all along, and after 3 treatments, my visual acuity in my right eye went from 20/40 to 20/20, which kind of seemed to make people think, wow, this is unbelievable. And in my left eye, I literally, after my operation, I couldn't see the big E on an eye chart. And although I still can't see it straight on, peripherally, I have gained vision in my left eye.
And you're just starting the treatments.
Yes, I've had 9 treatments.
Wow.
So far, and now I'm in the 4-month downtime, and after 4 months, I'll start my second round of treatments. I am very pleased. I'm very pleased with the whole thing, and I think the biggest point is, up until now, to be honest with you, I thought there was kind of no hope, and almost got a little bit dejected because I'm 70 years old, and I ride motorcycles, I fish, I just did 1,000 miles on a dirt bike with my kids from Pennsylvania to Vermont on dirt roads and trails. And without vision, that stuff isn't possible. Yeah. But I'm seeing better, I think, than I have in quite some time.
Have you discussed this with some of your friends about your eyes and what it's done for you?
Absolutely. It's funny you mention that because I routinely, people know me and know that I have an eye problem, and I've actually had people come to me and say, gee, I was just diagnosed with macular degeneration. In fact, I met a guy this morning at the diner, and I said, you better call the Stroudsburg Eye Specialists. It's worth your while to get down and get checked out and see if they can help you. But yeah, I definitely, that's the kind of person I am. But if I can help somebody, but I believe in it, and I think it's great. I really do. And I can't stress this enough. His staff. Now, I only go to the Tannersville office, but his staff was wonderful from every aspect, and it makes such a difference. And it also makes a difference that their staff are excited about this procedure and what they're doing. They're really upbeat, and like I said, they're ahead of the curve technology-wise. So it's all been a plus.
That's good.
And I'm very appreciative, of their efforts on my behalf.
Great. Okay, the only thing I want from you now, Scott, is that trout that you promised me when you go fishing, okay?
Well, that trout, I just got a picture of it today. My taxidermist sent it to me. And I'm just glad that I can see the colors of this thing. It's beautiful.
There you go. There you go. Yeah.
It's going to be hanging on my wall very shortly.
Great. Well, thank you so much. We appreciate it very much. And good luck to you, okay? Could you imagine how you've changed their lives?
It's humbling. I mean, to hear that, to hear the accolades for the staff, I'll make sure they hear that message. It's humbling. It really is. And like I said before, just a year ago, he would progressively get worse, and he'd probably go blind. He's only 70. So by 80, he's probably blind. So, this is life-changing technology. I mentioned this to you before. I think in my career, this might be the most impactful thing we see in eye care. And he's had a great response. I mean, the treatment period is 2 years. We talked about that before. So some patients get a quick result like him. I mean, but most patients, it takes that 2-year treatment to really get the maximum effect. But I'm humbled that he's doing so well.
My friends, remember the phone number is on the screen. There is absolutely no need for you to lose your eyesight. Hopefully, you have this great machine, and there's many locations. We're playing this show from north of New York down to Harrisburg in the Hellentown market. The phone number is on the screen. Give them a call, and there's 5 locations. You have Hazleton Eye Specialist, Pottsville Eye Specialist, Stroudsburg Eye Specialist, Bangor Eye Specialist, and Nanticoke Eye Specialist. I wish you the best. And it's always nice having you on. Of course, you're on every day with Eye Care Today. Yeah. My good friend, Dr. James Diem, who is doing wonders, and all your other doctors.
Yeah, I appreciate it. Yeah, it's great to be a part of the community and do what we do. Yeah. And I just, real quick before we end, I would just say, if again, anyone has macular degeneration, knows anyone, the first thing is to come in and see if you're a candidate. Right. See if it's something that can help you, because again, this is treatment that can be just life-changing for patients.
Call and find out if there's a seminar happening in your area or getting information about it. You'll be glad you did. Thanks for joining us. We'll see you next time.